appearing before a joint committee session of Health, County Affairs, Intergovernmental and Public Service. I am the chair for County Affairs, Public Service and Intergovernmental Relations. I'm Honorable Adolfo Mansuri, MCA Lumumba. On my left is the co-chair for Health and Sanitation, Honorable Abubakar Sugo, member of County Assembly for Wabiri Ward. On the extreme left is Honorable Rahman, who is also the vice chair for lands, and also a member of County Assembly for Ijara, and also the deputy majority leader. And his next is Honorable Aaron Odua, who is also a chair for environment, and also a member elected for Day 2 Ward. I think you have a blood relation with Day 2, they are not wrong, for introduction purposes. And the extreme left is also Honorable Mahad Abdelkader, a member of Odindache, who is also a member of Health Committee. Honorable Odua is also a member of Health Committee. Honorable Abdelrahman is also a member of Health Committee. On the back side is Honorable Omar Abdi, member of the majority, followed by Honorable Elisa Adam Abdi, a member for Savannah Ward. Both of them are members of County Affairs Committee. On my extreme right is the Honorable member for Daniel Idris Allen, who is also a member of County Affairs Committee, followed by Abdullah Ibrahim Sigat, who is also a member for Nanigi and also a member of this committee, County Affairs. We also have Honorable Hamid Noor from Dalmagala Ward, who is also a member of this committee, followed by Honorable Mohammed Sheikh from the Sigari, who is also a member of County Affairs Committee and Health also. We also have Honorable Timira Bishar, who is also a special elected member, followed by a member also of this committee, followed by Mana. Timira also doubles as the minority deputy majority whip. We attend the necessity in terms of leadership. We also have Mana Abdullah, Mana Ali, Mana Abdulrahman, special elect, also a member of this committee. At the back is also Honorable Professor, who is also a member of this committee. We also have support staff of Secretariat. On my extreme right, our Kalak for Health, who is also doubles also as a researcher for also County Affairs Committee. Is called Uwese, Atuma Uwese. The extreme left, our main researcher is also called Abdi Mohammed. There at the back is Tadia, the senior researcher. You also see Abdi, also Hansen, editor. And see Abdi Nasser, Salat, Faisal. The back there is Ibrahim, the communication staff also. Reciting Adam is there, reciting Adam here. He is also somewhere senior setting Adam. So I think it is your time to introduce your members.
Thank you, Chair, for that brief introduction. Thank you, Chair, for that brief introduction. It's our pleasure that you're having us here today. To my extreme right is Hassan Ragid. He's the Deputy Director in the Department of the Board Services. He's also part of my Secretariat. I shall start with myself. My name is Rakia Ibrahim. I'm the current CEO and Board Secretary of the County Public Service Board. To my left is Hassan Bashir, who is the payroll manager at the moment. Thank you.
Thank you. So well guided. I think if to start I must read to you the articles and the constitution of the powers of this House for friendly and for informative purposes. For 185, gives the Assembly the legislative authority which may make any laws necessary for effective performance of institutions and functions under the court table. County Assembly also, while respecting the principle of powers and separation, may exercise oversight of a county executive committee or any other county executive organs, which you are one of the organs. Article also 195, the county assemblies give powers to summon witnesses for provision of information and any other necessary information that they may need while executing their powers. Section 39 of County Assembly powers and privileges also gives powers to enforce witnesses to attend. If I go on also, I must mention to you Section 59 of County Government Act 2012, which gives you the powers as County Assemblies, County Service Board. I think you understand your role. One of them is to establish and operate offices. So I think in reference to those mentions, articles, and quotations from the Constitution, today our matter in deliberation falls under Article 41 of the Constitution, which states that every person has the right to go on strike. The Labor Relations Act grants all employees to have the right to join any registered union of their choice and shall not be victimized for being members or participating in strike. Article 41(1) also, under Section 59 of the County Government Act, the Public Service Board is mandated to exercise disciplinary control over and remove persons holding or acting in office, and due to this, they may dismiss people on medical ground or any other disciplinary things that they feel deemed right. So I think we will go into our deliberation today. I think the first question or the first agenda was tweeted by the co-chair of the Honorable.
Thank you, Chair. First, I want to go to the question directly. As we are aware that there is an ongoing strike nationally. First question, is this strike illegal? If you know, then maybe you can. If it's illegal, maybe can you provide some document shows that it's illegal? If it's not illegal, then maybe you can state. Question 2. Under the Section 59 of the County Government Act, the Public Service Board is mandated to exercise the disciplinary control over or remove the person holding or acting in office of the county. Did you dismiss any medical officers since the strike has been started? Since the strike is started? If yes, can you explain to the committees why their constitutional rights were violated? If no, if the County Public Service Board delegates any disciplinary functions to other departments, like maybe within the health, like county health management team, or the other department concerned about health, I mean the strikes, during this period of the strike. If so, to whom were these functions delegated? I thank you, Mr. Chair.
Rakia, I just want your guidance. Do you want to take holistic questions or you will answer one by one? Put it up.
I think I will prefer, thank you, Chair. I think I will prefer to answer every honorable member.
Thank you. Now you can respond.
Thank you, Chair. In response to your first question on whether the strike is legal, every person usually has a right to fair labor practices and to go on strike under Article 41 of the Constitution of Kenya. The same right is also enshrined under the Labor Relations Act of 2007. On whether a strike is lawful or unlawful, it's usually the court that actually determines that. And at the moment, the Kenya National Referral Hospital, KNH, basically moved to court to declare the strike illegal. And the court first issued orders on the 13th of March 2024, to which I have a copy today, which essentially states that suspends the entire strike, right? And mandates parties, affected parties, because this is a trade dispute, to go ahead, form a conciliation, and try to resolve the issue as it is. And that is what the whole of the national approach that was being initiated by the Chief of Staff of the Office of the President, Honorable Kosgei, was actually undertaking this at the moment. It has not yet come to fruition. The court also issued orders on the 17th of April 2024, at the same time, stating that despite the fact that even if the doctors had gone ahead to continue doing the strike, and undertaking the strike, then they should be there to provide emergency health care. And it was specific to a kind of level hospitals, so that's level 3, level 4, level 5 hospitals, and what cadres should be there at that particular moment. Because we know that also everyone has a right to emergency health care in the Constitution. The same way that every other person has the right to take part in a lawful strike, to take part in any activities that are organized by the trade union. At the same time, we also owe responsibility and a duty of care to those people who we serve. And to some extent, those are the vulnerable members of the community. So, to whether the strike was declared illegal, those were the decisions of the court that were in place. A notice was issued on the 6th of March by KMPDU, basically informing the parties and the public that the doctors will be going on strike on the 14th. Legally, they are supposed to provide a notice of 7 days. And some of the issues that we are having is that the County Public Service Board is basically the employer of county employees, right? We are the ones who recruit these people, they come under us. But even at the national level, one of the issues that we are having today is that that notice was never even served on us as the employees of the county government, considering that we are the majority of the employers in the health sector in the country. The same notice was not even provided by the representatives of KMPDU at our county level. So all we know is that people just woke up on 14th of March in the morning, despite the fact that the board at the time we were undertaking the recruitment of county chief of staff, something that I believe that every honorable member here is aware that the county did not have chief of staff for quite some time, and we are undertaking the recruitment, and the issue that we had was our board was not properly constituted. So immediately I joined, that was the first assignment that we had to undertake as a board. And we actually believe that if the court gave certain decisions and those orders, we felt like, our doctors, considering that they're also people from our home county, the people who have been here, people who we have sent to go and study, to become consultants, with the support of the county government at the time, then they will also be considerate of their people as we resolve this at the national level. With the second aspect is with respect to disciplinary control of the dismissal. As I believe at the moment, the County Public Service Board has not terminated and has not dismissed any member of the medical fraternity. Whether you are a medical doctor or a consultant, at the moment we have not issued any form of dismissal. Further to that, Section 86 of the county government empowers the County Public Service Board to delegate any of its powers, including disciplinary. And I would like to point you to our county, the county government of Garissa Human Resource Policy of 2018, which was approved by my predecessor. And it's a document that currently exists in the county, to which I believe that not many people are aware of this document. And Chapter 10 of that entire policy is dedicated to disciplinary control. Section 10.2 of that policy states that the power to exercise disciplinary control and removal of public officers are vested in the County Public Service Board as stipulated under Section 59 of the County Government Act. However, the board under this policy has delegated the following disciplinary powers to Chief of SAS, County Chief of SAS, on how to undertake this disciplinary procedure. That's the document I found. It's a document that exists in our county since 2018. Disciplinary cases dealt under delegated power shall actually be processed through the respective department Human Resource Management Advisory Committee. So as I sit here, as the CEO and the secretary to that board, we have not dismissed anyone. The delegated power is with the county chief of SAS, to which right now we have directors who are in acting capacity of that position, and we have human resource management advisory committees who are sitting in that committees. To some extent, we have received some correspondence regarding certain people who refuse to provide services to the county and to whom their salaries have been stopped. The same policy provides that if there is any action that is undertaken by the Human Resource Advisory Committee, the appeal shall lie to the County Public Service Board within 30 days. So what we do not understand today is whether our doctors also believe that they are our employees or they do not believe so. Because as I sit here, I have not received any appeal, I have not received any complaint, I have not received nothing from any medical doctor who is currently serving in the Garissa County Public Service. Thank you.
Before I hand over to the question owner, I think on the matter of the notice which will be provided to you by the KMPDU, we said, you know, before we engage you, we have engaged them. We have also engaged the office of the county secretary, and we also wrote to the CDC for help, although it didn't appear, but the information they provided for us. Now, there is certain contradictions. One, I would like to request to you, from you, if you have a copy of those court orders,
Yes, I
you will provide to us. The other one, the KMPDU officials say they served you with a notice, and they have provided us a copy of that notice. So I think when you say you didn't receive, I don't know how I can judge you, but they already said they provided to you. So what I wanted from you now to prove the evidence of denial where you don't have, but the court order provide to us if you have a court order. Declaring the strike illegal, and on the matter of dismissal, there is a follow-up question.
Go ahead, please.
Thank you, Chair. Regarding the notice that has been provided by KMPDU, I can assure you that notice is something that I might have seen in social media, but it is not something that was actually served on the County Public Service Board. And when a notice is served on the office of the governor or the county secretary, it does not mean that the County Public Service Board was served as an institution, because we are an independent institution under the law that have their own powers and their own mandate under the law as it is. If I may continue, pursuant to that, from the decisions of 13th of March 2024, the County Health Management Team, the CHMT, actually also issued notice to the doctors and the consultants that they were supposed to be at work by the 25th. And if they did not do so, then certain disciplinary actions might be taken against them. So a notice of about 5 days were issued to them. The same notice also required the CEO of Garissa General Hospital to also submit the names of the consultants and the doctors who failed to appear to work. And the same list was submitted, and those are the people whose salaries had been stopped.
On the matter of the notice, I think we are one county, all Garissa County government. We only have two arms, the legislative arm and the county executive arm. I think the office of the county secretary also serve as head of public service. Is it not right?
Yes, it is.
So, as the head of public service, you might have been served. So, is there any...
The same will be also independent.
Listen to my question. I'm building up my question. Is there any nitty-gritties in between you, your office, and the office of the county secretary? Because if he has been subbed, you know, he's also the coordinator of all government business and all government functions. Any letter that is misdirected is the one to direct it. So if KMBDU knowingly or unknowingly served him, he could have served two purposes. One, to receive as a head of public service, and also as a county secretary who runs the affairs of this county. So I think if there is any misunderstanding between those two offices, although I don't want to dwell, be cautious on what you will present to us, because we cannot judge them. They didn't serve you. They served the head of the public service. So let us end up there, and sometimes you need to look for a way of working together as a coordination and cooperation between the offices and the organs of the county that exist, because the county belongs to all of us. I will rest my case, and I will say KMPDU, as per the way they said and they told us, and the county secretary alluded, they served the notice as per the required standard. Thank you.
Thank you, Chair. Through the Chair, I think it looks the series misleading the House at large. Procedurally, I think the question I was supposed to raise, you have already given our direction. The doctors came to us and sat in front of us and confirmed that their salaries were being stopped. And it's very unfortunate the CEO is not even aware what's going on in the county. Does it mean that the county government is being done by different sectoral work, or it is general, because she is in charge of all the personnel and all the employees in the county, as she stated in the first question? So I want her to confirm that she is in control of all employees in county, so that the information has to capture that statement very clear, because this is a house of rules and procedure. If the CEO is not aware, let her tell us she is not aware. And if she is aware, she can confirm to this house that already those are the doctors we came to the house and clearly stated that their salary was stopped, and we have clear information of that. So I want her to clearly explain that she is not aware, or she is aware that the doctors are not up to today. Thank you.
A follow-up question.
Yes.
You have said their salaries have been stopped.
Yes.
Yes, okay.
Not all doctors,
Not all doctors, those affected.
Yes.
Okay, there's a procedural that's been before you can stop their salaries.
Yes.
One, it's a verbal warning. Written warning. Second, written warning. Third, a written warning. And show cause letter, interdiction, and final dismissal. Will that procedure be followed? If yes, kindly give us any documents that shows that there has been followed that procedure.
Chair.
Thank you, Chair. Honorable Akira. Just down.
Thank you, Chair. Chair, I think I'm part of the appointment committee, and the ink that vetted the new CEO still wait on some of the documents. And I thought my sister will bring a new change. We heard the CS some days ago, and what the CS narrated and what the CEO narrated, it seems very conflicting. Can the CEO confirm when she wrote the delegated authority on disciplinary cases, whether in the 2 months, because she's still on probation, whether in the course of the 2 months she was in office, she wrote a delegated authority on the disciplinary, because the CS confirmed that they don't have the committee, and it's the purview of the CEO of the County Referral Hospital, who knows whether the doctors came on work or not. On the issue of whether anyone was dismissed or not, probably she said no one was dismissed. The county secretary confirmed that there are 101 medical officers, including consultants, of which 17 were dismissed. 17 were dismissed. And some of and salary stopped. I think 5 were dismissed, and then the rest had their salary stopped. He couldn't provide any document. And my sister is now saying that probably there was no one who was dismissed. I think this house is a house of rules and procedures. If the CEO can confirm whether they can bring the delegated authority on disciplinary cases to the health team, because the CHMT has no role on disciplinary cases other than the facility. Garissa County Referral Hospital is a distinct entity with its CEO and the board and management that can undertake disciplinary cases within that facility, not the CHMT. The CHMT runs the entire operations of Garissa County Health. I think if my sister can provide a letter that she wrote on the delegated authority on disciplinary cases to the CHMT and not the facility CEO, the management, and the board. The function of the board and the CEO is to manage the operations of all the facilities, including disciplinary cases within the facility. Thank you.
Thank you, Chair. Before point of correction, I think Madam CEO is not on proposition. She's not in corporation. She's appointed. That's for point of correction. Go ahead, Madam.
Thank you. Thank you, Chair. If I may address. And the Honorable Member requested for a document that essentially states that this is a delegated power to the CHMT. And you will hear what I had earlier said is that we have a human resource policy that this county has adopted in the year 2018 through the former board, and my predecessor is the one who actually approved this policy. The policy has an entire chapter dedicated to disciplinary issues. And the disciplinary procedure that's stated here, it's usually vested. This is a delegated power through the human resource policy that we have given to the Chief of SAR through his advisory committee, that department's advisory committee. So that's not a delegated power that has emanated from myself or from the board at any moment. It's a policy that is in place that everybody should be aware of as long as they are in the county public service. On the second question, it was with respect to whether certain procedures have been followed. The procedure that is required is where an officer is absent from duty without leave or reasonable or lawful cause for a period exceeding 24 hours and is not traced within a period of 10 days from the commencement of such absence. The officer's salary shall be stopped and any action to dismiss the officer initiated. The action that had been undertaken by the Human Resource Advisory Committee of the Department of Health is something which was undertaken on the 26th of March 2024. This personnel had not reported to work from the 13th of March 2024. To some of them,
let me intervene you on issues.
Yes.
You're talking on a normal situations of a disciplinary matter.
Yes.
And I think today I read to you our matter and our topic of discussion is the strike crisis of medical personnel in Garissa County. We're asking these situations of victimization of individuals who are doing something that is their right, as they think or as they just deem fit. Referring to us also, HR human advisory policy that is existing in Garissa County is what